evening, my friends. Welcome back to another episode of To Your Health with Dr. G. We're here on this Wednesday night talking COVID. We are back. I had my hiatus. I'm trying to break away from some COVID talk, but we're bringing it back to you. Those of you that have been following us on social media this week, I'm so excited to bring this show. Tonight, we're doing addiction in the age of COVID-19. My name is Dr. Mark Gomez. Welcome back. I'm a board-certified internal medicine physician at Howard Hospital, Illinois. You can check me out on my website, www.drmarkgomez.com. I'm also an advocate of #lifestyle medicine. I'm so excited to have everybody back here this evening. I'm social distancing, got my swag. You guys should be doing it too. We're social distancing tonight, talking about addiction in the age of COVID-19. We're here today to bring the thunder. And each week, as we always do on To Your Health with Dr. G, it's my goal to really connect you with the experts that are out there practicing whatever we're doing. Tonight's experts are fierce, and I'm going to introduce you to them in a few moments. But really, we're continuing this conversation. We took a little bit of a break from COVID, but for the next 3 weeks, we're going to be bringing you real stories, have real talk about the impact that COVID-19 has had on all of our lives. We've all had some skin in the game. There's no doubt about that. It's all affected us in different ways, but we're going to talk about it. So I'm so excited to kick things off tonight with my addiction and COVID-19 show. And really today, yes, we have a serious tone of everything. We're talking about your health and your well-being. But at the end of the day, I want you to have all the tools necessary for continued health success for you, your family, and your loved ones. So what I want to do, of course, is welcome everybody back here, meet the guests in a few moments. Like we do every week show, we're all about really bringing you the truth at the end of the day. We're all about delivering trust and delivering truths. So here's what we're going to do today. You're going to meet just an amazing panel, and we're going to have some real good conversation about what's going on and how the impact of what COVID-19 is doing for us. But before we get into that, let me hit you with a quick disclaimer. The content of To Your Health with Dr. G is for informational entertainment purposes only, and that the content is not intended to be a substitute for professional medical advice, diagnosis, and or treatment. Further details can be found at www.drg.com/disclaimer. So here we are today. We're talking about a very important topic. And as you know, right now, the impact of COVID-19 has affected everyone. And we know that some populations have been affected more than others. Today, we're going to be talking about the population that's already been stigmatized, marginalized, and underserved when it comes to access to proper health care. At the end of the day, everyone, in my opinion, everyone deserves equal access to health, equitable treatments that are out there. And certainly this pandemic that we're in has certainly thrown us for a couple of loops. But we're really here to try to set the record straight and talk about the opportunity that's still there. And we're going to talk about this with some great guests. So what I want to do is, of course, introduce my first guest today. He's been on the show before, and he's a really good friend of mine, longtime friend, colleague. He and I actually met a number of years ago when we were doing some work on the hospital opioid crisis subcommittee. And so that's really, we got to really see a lot of each other and really bounce ideas about how can we make things better? How can we make sure that people that are marginalized get the same access to treatment? How can we help people for those that are in need? So I want to introduce my good friend, longtime friend and colleague, Dr. Aaron Weiner. I want to read his credentials because his credentials run deep. Dr. Aaron Weiner, PhD, ABPP. He's a board-certified psychologist and director of addiction services at Linden Oaks Behavioral Health. Check him out, www.eehealth.org. Dr. Weiner, welcome back to the show.
Thank you so much. Always a pleasure to be here. Excited to talk about this important subject.
Hey, Dr. Weiner, tell us a little bit about yourself. Where did you do your training, and a few opening words about this topic of addiction?
Yeah, absolutely. So I got my doctorate from University of Illinois, Urbana-Champaign, did my pre-doctoral internship and postdoctoral fellowship in addiction psychology in the VA system. Right now, I'm the director of addiction services at Linden Oaks Behavioral Health. Addiction has been the focus of my career since I launched it. Like you said, folks who suffer from addiction are already in a population that has difficulty advocating for itself and has stigma that runs very deep. And what we're seeing right now, unfortunately, and I know we'll get into this in the show, is that this pandemic has actually just compounded the challenges in terms of receiving care, getting peer support, lots of things. And so it's a really important topic to address tonight, and thanks for having me on.
Hey, you. It's been a pleasure to have you back, and until we get a little more granular on some of the substantive matter at hand. I want to introduce you guys to my next guest. They are a power couple, and I had to get a shout out on my video blog yesterday, but we're recent acquaintances, but when we had our connection, we really connected hard, and I want to thank actually Dr. Weiner for actually trying to connect us all. Again, I really believe that we're here with a common purpose to really serve our fellow citizens, our fellow human being. And so amazing how the world kind of works, certainly during times of crisis where people can still come together and unite around a common theme of hope and recovery and survival. So I want to introduce power couple. I want to introduce them awesome, Brad and Jessica Gerke. Let me read their credentials. And they got a little bit of separate credentials, but I want to give them their due time. So I want to read their credentials individually. So I want to introduce Brad Gerke. He is co-founder 516 Light Foundation. Check him out, www.516lightfoundation.org. He's also director at Banyan Treatment Center, Chicago. He's an appointment member of DuPage County Hope Task Force. He's also a recovery coach with the Naperville Police Department Connection for Life program. He's also a recovery advocate and speaker. I want to introduce Brad there in a second. I want to just introduce Jessica, his awesome, powerful Jessica Gerke. She's also co-founder of 516 Light Foundation, www.516lightfoundation.org. She's intake supervisor at Banyan Treatment Center, Chicago, recovery coach, Naperville Police Department, Connect for Life, and recovery advocate and speaker. Brad and Jessica, welcome to the show.
Thank you. Thank you for having us. It's an honor to be able to come on and spread some hope and come together during this time.
Wonderful. Hi, Jessica. How you doing?
I'm doing good. We're excited to be here. Pumped.
Well, please tell us a little bit about your guys' background and a few opening words on why this topic is so important to you.
I think this topic is so important to us in a time of a pandemic and just in normal times because there unfortunately are a lot of people passing away from drug overdoses. So anything that we can do to get out there and spread awareness, education, and resources, we want to jump to the plate and be able to help, be that source or that resource to be able to help people during this time. And in normal times as well.
Awesome. Jessica, a few opening words on this topic from your end.
Absolutely. So, Dr. Aaron Weiner said, got his credentials. He was like thinking, I got my credentials on the streets of Rockford. So, I'm in long-term recovery, 11 years sober. I'm a student, a shout out. I hope some of my fellow peers, I told them, please tune in because they've been super supportive this semester. Brad and I had launched the foundation officially this year, and we're very excited to kind of bring resources to the community, spread awareness, and just kind of get out there and be with the people and in this desperate time because it's definitely needed.
Wonderful. Well, thank you both for coming on. Now you guys have it. You met our guests. And let me say this, before we get into the question of the hour, the situation where we're going, chief complaint, I want to say this. In times of crisis, we know that people may turn to addictive habits as a way to cope. We all may have a different way to cope. But I want to make sure it's that the same people that are already stigmatized because of choosing substances that are already underserved, I want to make sure that those people have access. Those people might be facing the same barriers that are out there from the get-go, and it can be compounded, as Dr. Weiner mentioned a few moments ago, during this time of crisis. So when people come into my office, we call it the chief complaint. You like that one, Dr. Weiner? The chief complaint, aka the question of the hour. And so here's what we're dealing with. We're talking about a population that's at risk, and it's been more so during this pandemic. So here's a question. How have current public health measures impacted addiction rates? In addition, how do we best balance these measures with the essential support services needed by those living with addiction? So I want to start with this. I want to just have Dr. Weiner kind of turn over. I'm also going to have Brad and Jessica chime in too. But Dr. Weiner, in your own words, when you hear the word addiction, what does that mean?
Yeah. So we look at addiction as something that has got a biological component, a psychological component, and a social component. So a biopsychosocial problem. And so it's not just a brain disease, although that's certainly part of what goes on when you're in active addiction. There's all these components, and so it creates this web. It's very difficult to get out of, and that's part of why for a lot of folks to get out of it, they do need to go to some sort of treatment service. It's by the time it really takes hold of you, it's nothing near a choice anymore.
Brad and Jessica, why don't you be your take on the word addiction? When you guys hear that word, what does it really mean to you?
When I hear the word addiction, especially when it comes to substance use disorder, I think of it in a couple of different ways. But for me, in my story, I was unable to break the cycle of stopping. I would have every desire to want to stop. I would be able to take a lie detector test if it was available. When somebody would ask me, Brad, do you ever want to use again? I would say, my God, no. I would pass it with flying colors. But then 2 hours later, there I am getting high, trying to figure out what happened. And I've kind of come to understand it as an allergy of the body, right? Me being an alcoholic and drug addict, the minute I put something into my system, my body reacts differently than a non-alcoholic or drug addict. I get a physical reaction, right? A physical allergy to where my body craves more of the same. And if that were the only problem, I just wouldn't pick it up. But me being a drug addict alcoholic, when I'm stone cold sober, my mind tells me somehow, some way, someday I'll be able to control and enjoy my drinking and my using. So I go ahead and I take the action, I pick up a substance, I unleash that allergy, and further down the spiral I go. I wake up the next morning full of shame, guilt, and remorse. I don't like the way that I feel. So I search for the sense and ease and comfort of a drink or a drug, therefore continuing the cycle indefinitely until I have some kind of rock bottom or some kind of intervention that comes and pulls me out of that situation, like Aaron was talking about, getting into treatment, be able to get the fundamentals, the foundation, and be set to some kind of road to recovery with the needed support. Me alone, I cannot do it.
Yeah.
And Jessica?
Yeah. When I think of addiction, just kind of bouncing off of what Brad said, he talked about that physical aspect of addiction. What I'd like to focus on is that mental that comes with addiction. And in my own experience, I think the best way to explain it is when I'm talking to a group of people is, have you ever felt nervous? Have you ever wanted to, had that fight or flight feeling? Well, that's what it feels like to be an addiction, to be uncomfortable in your own skin. So what do you do mentally? You want to get out of that frame of mind. Yeah. So there's these words that say that the main problem centers in the mind rather than the body. So that's where the work needs to be done. Therefore, going into places like treatment and getting therapy or actively working a 12-step program are absolutely crucial, because we have to change our way that we perceive drug use. You want to get out of self. You want to stop feeling like uncomfortable in your own body. And this is the important piece where those services that are needed come in.
Wonderful. Thank you, Jessica. From an internal medicine standpoint, I tell people this: addiction is just as real as atherosclerosis, as heart disease, as hypertension, as diabetes, cancer. And when you talk about the motivator, the drug itself becomes the single most powerful motivator in somebody's existence that deals with this. Dr. Weiner, break it down for us a little bit, just in simple layman terms, about the effect of the drug on somebody's brain. What happens to make that kind of connection? As I said, it becomes the single most powerful motivator for somebody's existence. Yeah. What happens in the brain?
Yeah. Well, so kind of, as Brad and Jessica mentioned, your brain actually does react differently. So once you hit that point where your body develops a dependency on it, when you're presented with the drug, even maybe the images of it or something you associate with it, like a place or a person, those sorts of things, your brain lights up in a way different than it did before. And that reward pathway just gets burned in. And then actually what happens as well is that other things in your life that might give you pleasure and might be motivators start to fade away. And they stop being as important to you. And so there's this really strong biological draw to it that gets people thinking that certain ideas make sense when they're in active addiction, that anyone from the outside, or even they themselves, when they're not in the middle of it, might not think is the case anymore. And so that really is the central part biologically of what's going on with addiction. Beyond that, though, the psychological end of it, it's actually kind of interesting when you think about it. One of the hardest aspects about getting yourself to the place where you're ready to stop is connecting your use with the negative consequences in your life. Because unlike with other things that cause harm, like if you've got a kid and they touch a hot stove, that's like, ow, right? And maybe they do it maybe like one more time, But then they're like, that burns me. But with drugs and alcohol, it's almost like the first few times, maybe it even feels good. And then the pain doesn't come until later. And so you really have to find a way to connect what you're doing with those negative consequences. And sometimes that takes a long time. By then, your brain's already made the change.
So as we're seeing here now, and I want to link this, thank you, Dr. Weiner, for breaking that down. As we see now, I want to link this into what we're really dealing with, the elephant in the room. We're all in place, all dealing with the pandemic. We all got skin in the game with this pandemic going on. You know, if anything that's happened, this pandemic has really brought to light a lot of dysfunction, or exposed some of the dysfunctional aspects of the healthcare system, whether it's from the healthcare itself and who gets care, from support services that are now being closed or things like that. But it's been exposed, and we have to deal with this reality. So let me ask this question to Brad. You know, we know that people have been always struggling with substance use and abuse disorders for a long time now, and now we're seeing some rising in the trends. Do we know why people may choose to go down this pathway in a time of crisis?
Good question. I think a lot of it has to do, whether it's somebody that's just newly engaging in addiction or alcoholism, or going down that path due to boredom, the isolation, or having financial insecurity. And then also with somebody in recovery or actively using as well. A lot of the isolation, the boredom, the fear, not really having certainty in the future right now, and just kind of picking up and engaging and passing time. I've seen, unfortunately, some posts and stuff like that on Facebook and whatnot with different drinking games, or having quarantinis, or, you know, just kind of different ways of them being able to socially gather on through Facebook or something, doing different drinking parties and whatnot.
Jessica, let me ask you this question, and I'd like you to turn on that. From your perspective, and especially when you're doing a lot of work as an intake supervisor and you're seeing people come in, you know, how have you guys, first of all, let me ask you this question, Jessica, how have you guys been impacted? Has this impacted your way to conduct business as usual? Are you able to still see people face-to-face, or has it kind of change your approach to reach people?
Yes, we have been affected as a whole as far as providing services. People are scared. You know, this is a great excuse why not to go get treatment as well. So you're fighting against a couple of things here. You know, people coming in, they're not unsure of the surrounding, if you had any cases of COVID, so there's that lingering. The screening process is much more thorough, therefore it prolongs someone getting into treatment. Rightfully so, we want to protect everybody that's in treatment along with the staff. So that process has slowed down, and in some cases, you know, we have to do it virtual, so it changes the way we approach an intake process, where it's usually more, you know, one-on-one basis, shaking a hand, welcoming, just taking a few minutes to be in the same room with that person and let them relax, because a lot of anxiety is surrounded walking into treatment. So yeah, we have certainly been affected, and in some cases, unfortunately, some treatment centers are unable to provide services at this time.
You know, one of the things that I've been dealing with as a physician, as I switched to telehealth and telemedicine, is it's been a little harder for me to really, even though I've known a lot of my patients for a long time, I have to kind of take a step back and say, hey, you know, I have to make sure I ask you about how you're doing, like, how are you doing? And with sincerity too, not just say, hey, how are you doing? How are you doing? How are you handling staying at home? Are you handling, now you have to teach your child, or now I'm handling, you know, I'll recently lay off from work for something like that. But I have to now just try to consciously tell myself, ask them about, have they been sleeping? Have they been feeling on edge lately? So I like to ask those kind of questions. So Dr. Weiner, let me ask you this. How would you start, you know, if people are out here listening to us and they're worried about something, or they're worried about maybe falling into a bad habit of addiction, or temptations there, how do we stop that from happening? How do you identify somebody in the process, give them the tools now remotely, and then hopefully that they succeed?
Yeah, well, so I think that awareness and knowledge is really the most important part. I mean, so I've actually been doing a lot more telehealth since COVID started as well, and I've been taking on new patients. And it's been, certainly anxiety has been a major issue for just about everybody, but it's been really interesting to hear how many people have actually gone to alcohol who might not have been doing it before and have been using it to try to cope with their stress. I think the first, what's useful though is that when they're talking to me, it's usually not actually for the alcohol right now; it's for the anxiety. But I ask as part of the assessment, what's going on with drinking, and we can have a conversation about it. I think a lot of people don't realize how much is a problem. What's the average amount that someone might be drinking? Like the average adult male or female might be drinking in a week, and they don't really see how high their use has gotten. I think the other thing, just for those listening or those concerned about someone else in their family, is to look into whether or not someone is using a substance to cope. Because, we can talk a lot about, our own opinions about recreational substance use of all different types, alcohol inclusive. However, if someone's using it on a daily basis to cope, that's where the real warning flags come off, because that's where you start really building up that tolerance that leads you to trouble. One last point I want to add, piggybacking off of Jessica with the fear. I had someone reach out to me actually who was concerned about alcohol, and they really needed to go to the emergency department as part of their detox step because of how much they were drinking, and they were too scared to go. Everyone's seen the pictures, everyone's seen the news about how things are overflowing, and it's like very few people would knowingly would want to put themselves in there, but at the same time, alcoholism can kill you, as Brad could probably tell us more about. I mean, it's very serious. And so it really creates this conflict for folks who need help.
I've been trying to tell people, and maybe hospital systems, health systems could have been better at the messaging at the onset. We were saying, stay away, stay away, stay away, stay away. We don't overcrowd our hospitals and overutilize the resources there. And that may have actually compounded some of the fear where they say, oh my gosh, the hospitals are going to see an influx of all these people, and I don't want to get sick myself. But I will assure you that healthcare systems want to save as their number one priority. I've actually been telling people all along that business as usual. I mean, we're open for business, but I think health systems could have been better and should do better at saying we prioritize safety from all costs, from not only our patients that we may see, our staff and our providers as well too, and say we are open. We've taken unprecedented measures to make sure that the environment is safe, and go from there. Brad, let me ask you this question. Piggybacking off what Aaron's saying, what are some kind of warning flags, or if you see somebody that may be diving towards this pathway, how can we get them out in this era now where we're doing a lot more distancing?
I'm sorry, what was that last part you broke up?
How are we getting people out of this era? I mean, how are we giving people the tools from your end to deal with this new era of social distancing?
It still broke up again.
I know.
Sorry.
I was
trying to say, how are we getting people the tools necessary during this era of social distancing?
Yeah, so I mean, for people that are in recovery, they're doing 12-step Zoom meetings and stuff like that. Through the treatment center that we're doing some telecounseling like Jessica was talking about. We're also giving people, when they're in treatment, they're all supposed to be wearing masks, which they are, washing hands. Even before admission, we're doing a COVID antibody test, which tests for the IgG and the IgM, just to make sure that everything's safe. But some of the tools I think that people could be using is reaching out to people that are also in recovery, finding sponsors, getting plugged in with the Sober Network. They're all over social media right now. There's different pages that are forming. Reach out to the 516 Light Foundation. We'll be able to connect you guys through that as well. For anybody that's watching and needs help, that's something we're very big on doing, is kind of being the Google of addiction and recovery, to be able to point people in the right direction so they get the help that they need.
Aaron, let me come back at you with this question. Do you know if people, just from a general standpoint, are there any factors that predispose somebody to addiction?
Yeah, so we've actually found that there are genetic factors to it. It's something that can be passed down, certainly, so that if you're exposed to the substance, you're more likely to be addicted with less of that exposure. But then a lot of it also is modeling, where if someone in your family is doing it, it seems normal if there's a permissive attitude. And then far and away, in terms of psychiatric concerns, trauma and childhood trauma is the number one thing where if you've gone through some very difficult times in your young life, trying to figure out how to cope with that when you're then entering into your teenage years and the availability of drugs become more, that seems to really move people towards using to excess to the point that they become addicted.
Hey, Jessica, somebody doesn't start somebody doesn't all of a sudden boom at their snap of their fingers become a compulsive substance abuse user. Usually, obviously, the first step is a voluntary behavior, but how does that become? Somebody may have maybe a voluntary alcohol, as Aaron mentioned, alcohol consumption is up during this pandemic. But how does somebody go from being a temporary user or a voluntary user to more of a compulsive user? And how can some other ways to stop that process in its tracks?
There's a speaker that I listened to one time, and he said, I don't know when I became an alcoholic, but I know I was drunk when I crossed the line. So, and it makes perfect sense. I think it should be known that, no child wakes up and thinks like, I want to be an addict. That's not how it works. I believe it's part of your makeup, seeking out a solution through using drugs and alcohol. And there's such a huge mental component to it, just to, deal with some of the emotions that we just talked about. Isolation, loneliness, fear, resentment, trauma, things like that. Nothing else or to feel relief other than using a substance for that relief. So over time, when you are, I guess, prone to be more addicted to something, it does progress. There is a piece where you cross that line, like that speaker said. I don't know when I became an alcoholic, but I know I was drunk and high when I crossed it. And that's really important because you don't know that another big piece to it is that there's a delusion. There's a delusional factor, and because you can't differentiate the true from the false. You don't understand where how you're harming your family or the amount that you're using. You feel like this is a normal life. I think I lived in that dark time for many, many years before the consequences started to catch up with me. Jails, homelessness, loss of relationships. And then at that point, I was able to say, okay, I have a problem. But I was so deep in my addiction by that point, like all the signs were there, but I couldn't see them because I was in that delusional state.
Are there things when, we can always Monday morning quarterback a lot of things that we've done in our past. Obviously, if we don't make mistakes, we can never learn. And I even tell a lot of my patients, I've made mistakes along the way myself. No, it's perfect, but there are certainly the opportunities that are out there. You mentioned, Jessica, a few moments ago, and I'll have Brad, I'm going to answer this question to Brad, but you mentioned a few moments, I want to piggyback on a few words you mentioned, homelessness and incarceration. And we know that those circumstances certainly exacerbate what we're trying to do now from a COVID-19 perspective of proper social distancing. As a matter of fact, when you have more confined spaces, more enclosed spaces in incarceration or not know where you're going to be at by homelessness, it puts you certainly at risk. So let me ask this question to Brad. So how are we really, there's a disruption, there's a potential for disruption and for people to get these services, especially if they're going from a shelter to another shelter or happen to be incarcerated. What are some steps that can be done, do you think, from your perspective, to make these situations better?
Reaching out for help is the number one thing to do. And there are people out there, resources that are still accepting people and wanting to be able to, help people through the addiction process. It keeps breaking up. It's hard to hear. I'm sorry. The other part of the
That's all right. I think you answered I think you had a great part. I want to ask this to Aaron and transition with that one. Brad mentioned a few moments ago about reaching out for help, but we know that some other kind of key services that are out there for people with substance use disorders, like syringe changes, getting clean syringes, getting proper medications, those can be disrupted during this time too. What are you seeing from your end when you're working with your clients?
Yeah, well, so I think that there's actually been a great outpouring of compassion and help. I think that everyone who's on like the harm reduction front, you mentioned the needle exchanges, fentanyl strips, people who are given out naloxone, Narcan, the antidote to an overdose. I think that all of us who care about this issue are aware of how important it is to keep putting these things in the hands of people who need them. So I don't think that there's been necessarily any reduction in that. In terms of people actually being able to get, say, medication-assisted therapy, things like that, I know that actually the federal government and then also numerous other agencies that are nationwide have released guidance for OTPs, opioid treatment programs, and others in terms of how can we continue to provide urine drug screens? How can, if people have to come pick up a dose, can they do that safely? Because there is a maintenance aspect of this on the medical side, on the medication side, where we need to make sure that it doesn't fall through the cracks. So I think that if you asked that question maybe 6 weeks ago, I think that I'd have a different answer for you. But as it's gone forward and people, there's a great network across the country for this where we share information and workflows. And so I think we're at a place right now where we're back up to functioning properly.
Jessica, let me ask you this question. We're talking about obviously some options that are out there and hopefully some treatment to get people the proper treatment and recovery. Haven't had maybe change our tune a little bit, how we provide those services. But we know that a lot of people may seek service because of maybe it's whether the court orders them to do so or a loved one forces them into there or really convinces them. But for every person that comes in for treatment, we know that we're not reaching others that would need treatment. How do we identify those people that need treatment when they might not be hard to, it might be hard to identify them in the first place? How do we get our message to those that need to hear it?
Right. Well, I think it starts with us as a community. We have to destigmatize what addiction looks like. There's a lot of shame and guilt by coming forward. Your typical housewife who is drinking throughout the day may be shameful to seek services. Sometimes, we have services that we're providing in a community and the community doesn't want them there. It's really hard for us to be there for, a community and provide services when they're saying, not in my neighborhood. So things like that, it makes it difficult to reach the people who are struggling. So what we're doing right now, going live on Facebook and being an open book and allowing people to know that you don't have to be shameful about, your addiction, that there is light at the end of the tunnel and there's hope, recovery is possible. We've been there. I'm here saying, like, I've been homeless, I've been to prison. I, was in a dark heroin addiction, and here I am 11 years into recovery, co-founder of a foundation, working for a treatment center, recovery coach for a police department, working with governors. I mean, the list just keeps going on. And maybe that's not going to be everybody's journey, but the most important piece to share is that you can have peace of mind, that you can have relationships back with your family, that you can live a productive life. And if you want to go back to school, go back to school. But we have to stop looking at it like it has to do with willpower. We have to destigmatize it.
Wonderful. Brad, do you want to elaborate on what Jessica said a little bit more?
I mean, I definitely think breaking the stigma is a huge thing for people to be able to come out and reach their hand up for wanting help. The communities coming together is so crucial. Doing public speaking engagements and stuff like that Jessica and I do usually gather some people that are afraid to come out and kind of participate in these things. And we've seen that definitely get stronger over the years since we've been doing this. When we first started doing it, there'd be 1, 2, 3, or 4 people come out. I think one of the last events we did, there was close to about 50, 60 people that came out. And a lot of people too, when they are hiding within their own 4 walls of the house, doing stuff like this is so crucial because it allows them to be able to watch from the privacy of their homes. It allows them to be able to get armed with the facts about themselves or somebody that may be struggling, and have them see like, here's 2 people that have, are in recovery, living in long-term recovery, living healthful and successful lives. And more importantly, being happy, joyous, and free, from going from the depths of hell, right, until the heaven that we live in today is nothing short of a miracle. And that's all because we put our hands up for help and said, you know what, yes, we need some help and we want recovery. And luckily when we did that, there were people there to show us the way that we're doing right now, live for other people as well. Just coming out and asking for help. I mean, there's so much out there and people want to do this. They really want to help them. For me, I'm a believer of, let's jump down in the hole with them and climb out of the rope, climb up the rope with them, let's get down in there and on the firing line and really show that this is possible.
Excellent. Aaron, let me ask you this question, Aaron. I love, first of all, I want to give just a quick shout out I want to just tip my hat for you, Brad and Jessica, for all that you've overcome. And now you're sharing your story. Somebody out there may be listening to this right now and says, oh my gosh, I connect them. They understand me, they feel me, and now I can now take the next step. And as I said in the beginning, we are a community coming together. We want people to have equal access. They want to have equitable treatments. And so we want to make sure that people have all the tools necessary for success. So let me ask you this, Dr. Weiner, as we're talking about treatment, an opportunity, again, I think kind of our charge right now is to keep this message going. How do you think we keep this message going? I mean, once COVID comes down, are we still going to have this dialogue that we need to have, or is the dialogue going to fall away, kind of how it was pre-COVID?
Well, that's a really good question, and it's something. So one thing that I've noticed, just to really nail home your point there, is that part of the reason why I'm doing clinical work right now is literally every one of the projects I was working on at a system level stopped. Now, granted, I am in a hospital system, and COVID is like everything in a hospital right now. However, starting that back up is going to be something that's very much on my mind after things start to transition back. I mean, we were doing things with opioid denaturing packets. We were doing things with navigation for chemical dependency folks out of the emergent. There were so many different threads. All of them just stopped. I know that there's all over from healthcare to legislation, there's all sorts of things that have been put on hold. So we really need to make sure that those of us who are passionate about this issue, lead the charge when we're able to do that and not say, well, it doesn't matter because there's COVID going on right now. This still has to matter. And all the regular things that had been going on prior to this dominating the news cycle in everyone's minds are still there, and they're still killing people. So we can't let that fall away. And I want to say one last thing also, jumping onto what Brad and Jessica were saying, I want to call out physicians right now, because I think that as far as stigma goes, I feel like addiction is like don't ask, don't tell, where they don't really ask into it, or maybe there's like a couple audit screening questions. You know what I'm talking about if you're in medicine, and that's it. But then you don't ask. And I think people need to recognize that right now, alcohol sales are up 75% compared to last year. Anyone coming in, family medicine, internal medicine, or even if you're in a specialty and think that it would be appropriate to ask, just ask the question. It's not an offensive thing. It's important to screen right now.
Wonderful, thank you. So what I want to do right now is I want to get into something that we do each week on Tier Health with Dr. G. It's called Myths versus Facts. It's all about setting the record straight. And I was coming up with this myths versus facts, and I was kind of thinking, I'm where my physician at, but I got to go, okay, I got to think in real talk, real terms. I got a panel of experts that are passionate about addiction, health, and recovery, and the approaches that are there. And so I kind of had to challenge myself a little bit for this one. So each week on the show, we bring in myths versus facts. I say a statement, the panelist says myth or fact. They give us a few sentences why it's a myth or fact. We're going to keep it going, boom, 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 boom. We're going to get to these as many as we can. We're all about building trust and delivering truth. Here we go. Jessica, you get the first statement, myth or fact. Here we go. Addiction is a bad habit, the result of moral weakness and overindulgence. Myth or fact?
We've been talking about that the whole time. That is a myth. And I say so.
Please explain in a couple sentences. Please explain.
Yes, it is a myth because it has to do with mental health. It has to do with the physical. And it definitely depends on, there's those perspectives out there, but the disease component, that this is, an addiction. Dr. Weiner talked about the genetic component, things in that nature. So we know it's not a bad habit. We know it has nothing to do with a habit. In fact, that's why it's got its own word, addiction.
Wonderful. Here we go. Next statement. This is for you, Brad. I got this one for you. Here we go. Here's a statement. Those recovering from substance use disorders have access to the same support services that were available to them pre-pandemic.
It's kind of bordering right in the middle. It's myth and fact. I mean, we do still have like 12-step meetings. It's all gone virtual. Everybody is trying to work with what they have right now. I believe a lot of places are up and running to the best of their ability, and they're adapting to the situation the best they can. I mean, we will get through this. There is hope and light at the end of the tunnel. Things just might be a little bit different in the present moment. So I would say, it is myth with a little bit of fact.
All right. Thank you. All right. Here we go. Dr. Weiner, I like this one. Myth or fact? Nobody will voluntarily seek treatment until they've hit rock bottom. Myth or fact?
I think there's a little bit of both in there too, and this was alluded to before. Really the bottom line is that you have to have a really strong motivating factor, because there's a lot of biological, psychological, and social factors holding you in place. So until it becomes more uncomfortable, until your fear of staying where you are is more than the fear of going without your substance, which is a very scary idea if you're caught in an addiction, you're not going to move. And so for some people, they do have to lose everything in their life. For some people, they can see the train coming and make the step beforehand, but you got to have a lot of motivation.
All right, here we go. Thank you, Dr. Weiner. Jessica, here's a statement. Myth or fact? You can't force someone into treatment.
I would say that's in the middle too, because you can technically force somebody into treatment.
I guess the court order can force somebody.
So that might be a myth, because you can. Now, can you make them do the work? No, but technically, I mean, I know for a fact Cook County has a Haymarket in their jail, so you literally could get locked up into a treatment center.
All right, thank you. Here we go. Brad, next statement for you. Here we go. We should strive to find the magic bullet to treat all forms of substance use disorders. The one-size-fits-all approach. Myth or fact?
I would say myth.
Please explain.
Magic bullet. Addiction is so case by case. You have to meet a patient or somebody struggling with substance use disorder where they're at. And you have to kind of tailor make their road to recovery from that point forward, whether that's one-on-one therapy, counseling, 12-step programs, refuge recovery, smart recovery. There's so many different options out there to where there isn't ever going to be one magic bullet. Now, if we come up with that would be great. But I mean, I think people are so much individuals and have so much different to offer just in life in general. Their recovery process has to be tailored to that as well. So they get engaged and they want to enjoy the experience of recovery.
All right, thank you, Brad. Here we go. We'll do a couple more of these. Here we go. Dr. Weiner, here's a statement for you. All right. I like this one on this list. Here we go. The longer the pandemic lasts, the more likely patients or clients will relapse. Myth or fact? It's kind of your crystal ball thinking into the future a little bit.
Yeah. I'm gonna go with fact here. I'm gonna go out on a limb and say fact. I think there's added weight. I think that as time goes on, as this gets harder, I think there's gonna be more people out of job. Basically, substance use is in many ways an unhealthy way of coping with stress and problems and anxiety and pressure. And so if you are genetically predisposed, if you were already starting down that road, the more that this mounts and the more stress that's heaped onto you, I think the more problems that we're going to see. Our society is already off kind of in the wrong foot in terms of increasing addiction and addictive behaviors in this period. So fortunately, I think the longer this goes on, the more problems we're going to see.
All right, we'll do one more. Here you go, Jessica. This one's for you. Here's a statement. We only need to worry about those people who were previously susceptible to substance use disorders prior to COVID-19. Myth or fact? Worrying about people only people that were susceptible prior to the pandemic. Myth or fact?
Myth. Definitely myth.
Please.
Yes. People who are susceptible, there may be addiction forming right now in the middle of the pandemic. I think Dr. Weiner just spoke on that, is that people are starting to use it as a coping mechanism to relieve whatever they're going through and living in the fear. I'm sure that in my own experience, I've experienced like high amounts of anxiety and fearful, because if you're watching the news 24/7, if you are, around people that are elderly or that are susceptible to the virus, you're in fearful. So if you're living in that state, seeking out substance to use it, you never knew, you're probably opening up a can of worms you didn't know exist. So.
All right, there you go. Myth versus facts, everyone. So we got about 5 minutes left, and this has been a great discussion. It's like the time's gone by super fast. Brad, Jessica, and Dr. Weiner. It's like feel like we just started, but I want to make sure we keep things on time and everything. So we got about 5 minutes left. I said in the beginning, we call it the chief complaint, the question of the hour, what we're dealing with in relation to health measures and how it affects addiction rates in the pandemic. We call it the assessment and plan when somebody leaves our office in the traditional medical standpoint. That's when you certainly give somebody a diagnosis, you give them a treatment plan, and most importantly, schedule a follow-up. So let's bring it on home. So I'll start with you, Brad. Give us a few kind of closing remarks, kind of take-home points for people to know about the importance of what we're talking about tonight in addiction as it relates, certainly during this pandemic that we're in. Give us a few take points for people out there that may need to hear a positive message on treatment and opportunity.
Sure. So, first and foremost, if you're out there, like we've been saying, if you're out there struggling, reach out for help. It's what's going to start you on your road to recovery. Second of all, if you know somebody out there struggling, or if you're struggling as well, and they're using opioids, make sure you have naloxone. Like Aaron said, it is the antidote to somebody that is actively overdosing. I think another thing would be important too is, seeing as we have these, a lot of these telecounseling things going on, if somebody gets hurt and a doctor prescribes opioids or something like that, they should also be doing a co-prescription of naloxone. So they're also having that antidote ready at their disposal. And also, with that being said, it also draws some red flags for whoever's receiving that prescription. So kind of maybe take a step back and say, do I really need these? Are these things really going to help me, or are they going to hurt me? Because they're literally giving me the antidote here. And then I guess last is hope. There is so much hope out there. Jessica and myself are living examples of that. We will get through this pandemic with living in long-term recovery, going full force with really trying to help as many people as we can right now. And if you're kind of on that teeter-totter, am I going to get through this sober or am I not? Know that, yes, you will, and reach out for help, because there are people out there wanting that.
Thank you, Brad. It's been a pleasure. Jessica, give us a few closing remarks about what people should take away from today's conversation and talk about treatment and opportunity.
Well, since I can't say ditto at what Brad said,
You can.
just to kind of, I guess, piggyback, almost saying the same thing. I think it's important for us to know what our resources are. We're in uncharted territory, and there may be some scary things going around while we're in a shelter in place, but know that we're here to help. You're not alone. That's so important. You're not alone. I know there's loneliness going on right now. Somebody who's watching this, who's home with themselves, who may be drinking, who knows? There is help. We want to help. That because there is such a deadly, fear that is penetrating our society, know that we as professionals are still here, and we want to help. We're a foundation that wants to help. I am a person, another woman. If you need to talk, sometimes it just takes that, just to talk, to get out of your own head. One of the things that I want to put out there is that the 516 Light Foundation, Light stands for Living in Great Hope Today. So know that you can join us in Living in Great Hope Today.
Wonderful. Thank you, Jessica. It's been a pleasure having you on the show. Dr. Weiner, give us a few take-home points today, really targeting, the opportunity that's at hand.
Yeah, absolutely. So first, let me say, I think you need to have like annual physical shows where they go like 90 minutes, or maybe, like the ones where like the 30-minute blocks in the office instead of
It's that concierge stuff. There you go.
Yeah, you know what I'm saying? Because it's like we're online right now. You can do whatever you want. All rules are up. But that part aside, I want to second what Brad said. That's a great example, actually. There's a piece of legislation coming out soon talking about co-prescribing of naloxone, the antidote to an overdose. This is a great example of a time when we as a society, as legislators, need to be able to walk and chew gum at the same time, where we can't just let things fall out just because we've got COVID right in front of us. And I think that that's going to be all of our tasks in a lot of different facets. And certainly this is one of them where we've been making such good progress. We don't want to let that fall. That said, in terms of anyone who might be having their own thoughts or questions about their use right now, I feel like what happened when this first broke and when the shelter-in-place order went out was people kind of gave everything like a free pass for like a week, where they're like, yeah, I'm going to do what I like, almost like it was the end of the world, like there was going to be a big tidal wave. And so it's like, yeah, kids can watch as much TV as they want and eat, I'll eat ice cream every night. But it's like we're at a place now where this is kind of the new normal for a while. And realize that just because you don't have COVID doesn't mean that your problems don't matter. The hospital systems, treatment centers like Banyan, Linden Oaks, we are taking every possible precaution to keep people safe, far and above maybe what you'd expect. Because you still need that help. If you have an active addiction, you can't just sit down and be like, I'll wait till this blows over. Because honestly, we might not have, say, like a vaccine for a while. Like this could be a long way off. So don't put yourself down. Don't discount your problem. It's real and there's help, and we are as safe as we possibly can. Don't let it grow in your house. Make sure you get some help and reach out.
Thank you, Dr. Weiner. And my final words are this: never stop investing in you. You are your best self. Even though there may be times of trial, despair, and uncertainty, certainly what we're dealing with right now, there is a hidden opportunity. The silver lining is there. There are people that are there for you. Total health care has not stopped. It continues to go on. And I want people to hear that loud and clear. The best thing you could do after today, hearing this message, is to share this message with others. Share it with those that need to hear this. It's the only way that we can reach everyone. As the saying goes, it takes a village. And it takes a village to combat the downsides of addiction and create more opportunities for all of us to live healthy and better lives together with our loved ones. So I want to thank my guests today. It's been awesome. Dr. Aaron Weiner, PhD, ABPP, board certified psychologist and director of addiction services at Linden Oaks Behavioral Health. Check him out at www.eehealth.org. I want to thank Brad and Jessica Gerke, co-founders of 516 Light Foundation. Check them out, www.516lightfoundation.org. They've just been an amazing group of people to talk to. Hey, you guys have been listening live here on Facebook. This episode was written by me, Gomez, MD, and Tiffany E.R. Gomez. Music is by the wonderful Mr. Havis. Producer is Tiffany E.R. Gomez. Copyright 2020 by International Wellness LLC. All rights reserved. It's been a pleasure, everybody. Stay tuned for my show next week. COVID